I want to thank you all for being here. It's been really important as we see, hold on one second, as we see our numbers really start to climb, and it's been very concerning to us. So the county judge and I, as you know, have been working really close together to make sure that we put out the information to work with our community and continue to advocate to do the right thing. So if you've noticed in the last couple days, and really we've seen the trend going up, and just in the last couple days alone, we've had almost 800 positive cases, and that's something that's really become very concerning to us. I can tell you, and I'm going to give you some comparisons. It's really made me, you know, and the judge, as we talked, it's really been very concerning to us. We go back to the prior month. Our hospitalization rate is now 8.85. And our average positivity rate is 12.85. Let's put this into perspective. October 12th, our 7-day rolling rate was 122, so we've gone 122 hospitalization rate. Today we're at 187, and that is the number that we're going to talk about. A month ago, the rolling average new cases was 141. Today we're almost at 300. So we're trending upwards. Cumulative total breakthrough lost lives stands at 35, and our cumulative loss of lives is 2849. I can tell you that one more life lost in our community is one too many lives, and it's really important that we talk about some of the things that you know, the holiday season's coming, and that's very important to us. As you see the holiday season's coming, know your surroundings, know who you're with, make sure you're with your family, people that are vaccinated. As we see, there's still breakthrough cases, but most of the cases we see today are people that are not vaccinated, people that have not decided to get the vaccine. Our last report, we had 9 people, unfortunately, that lost their life last week. One of those lives was somebody that was a breakthrough case. A month ago, our hospitalization rate was around 6. Now we're close to 9%. So if you look at the percentage, it's almost over 30% increase in hospitalization rate. And I'm going to give you some stats which I always have here for you that are important to us. 5 and up, and as you notice, we do have the vaccine available to children 5 and up, and we're working with some of the schools to have pop-up sites, and also for all the sites in the city, we are providing vaccination for kids that are 5 and older. 783,994 El Pasoans is our population count. We're talking about that it's 5 and up. 1,195,905 vaccine doses have been administered. 68.5%, and that's 5 years and older, are fully vaccinated. The state's only at 54%. So you see our great numbers, but you see our great concern too, that it's not only the vaccination, but it's also the people that are starting to be infected, and it's affecting all of us. 80.6% of 5 years and older of our population is partially vaccinated, 62% in the state of Texas. And this is a number that is just an incredible number. Almost 91% of 65 and over is fully vaccinated, and 99.99, so that's like 100% of people over 65 are now fully vaccinated. But the positive test, you know, we've, like I said, has become a big concern in the last 2 days. We're at almost 800 in 2 days. And we need to make sure we have 74 people in ICU, and again, 181 people currently in the hospital. So our message will be, and our united message is, please wear your mask, please sanitize, please social distance, and I can tell you that know your surroundings. When you're doing your holiday season now, as you know, we're starting today to the holiday season through the end of the year, please make sure that if you're in a gathering, you know who you're with, and make sure that you take proper precaution. Now, the county judge and I have been very, very vocal of making sure that we protect our community. Back in March, when the governor said you didn't have to wear a face mask, we talked to our community, and our community was very responsive on wearing face masks. Our community was very responsive in making sure that when we were able to open the restaurants, we didn't go to 100%. We started 50, 60, 70% to make sure that we were able to have the safety not only of the citizens, but of the team members. So we want to go back a little bit and make sure we start doing that again, so we don't go back to where we were a year ago, October, November, and we were one of the worst cities in the whole nation. So this is a very important press conference because I want people to be aware of what's going on and make sure that people are very aware of their surroundings. Now, it gives me a great pleasure to introduce a great friend of mine, Judge Samaniego. Thank you, Judge. Thank you.
Thank you, Mayor, and as always, always a pleasure to be working together. Today I want to talk about the fact that, history repeats itself simply because we don't learn from it. And so some of the lessons learned, we're at a pivotal point, and we've seen that before. The mayor and I are very conscientious that we're at a pivotal point that we can either take off in the wrong direction or we can stall it. And we know that's possible because we've seen it as we look back. We learned very quickly that the media was extremely important, that the media played a huge role, and we want to thank you for the consistency, for not saying things or alarming when it was not necessary. That was a great relationship. We also learned that the mayor's relationship, the city, and the county are extremely important, and the collaboration between everyone else. I think we've learned that what the mayor has said, the very basics, social distancing, wearing your mask, making sure that you're aware of your surroundings. But we also know that the flu last year was very much held back, and when that happens, we learned that by wearing the mask, that therefore the flu does not hit as hard, which means that we have less people in our hospitals, and we're able to attend the more severe, which would be the COVID cases. So wearing the mask, we've learned that not only because of the COVID, but going into this winter months is going to be exceptionally important. We also learned that telehealth was extremely, extremely important, because when people were delaying their health matters and not going into hospitals, what happened is that right after things got a little bit better, our hospitals got saturated with people that had non-COVID. We also learned that the first line of defense is being healthy. We know that from our 2,851, the percentage is almost 98% of people who died had underlying conditions. So we know that taking care of your health is going to be a tremendous contributor to that. We also learned that the vaccination works, and I still find it sort of difficult that we know that nothing was more important. Remember that the vaccination, the main component of vaccination is to keep people out of the hospital. You keep people out of the hospital, you keep them out of ventilators. You keep them out of ventilators, the chances of death are much less. We also know that, right now we're at 15.3, we're at 15.3 new cases per 100,000. Today, our 7-day average is actually at 33.5. We also know that, our hospital beds, we talk about saturation. Here's a difficulty. We have space right now, we have beds, but we don't have personnel. And we don't have personnel as an outcome of what happened with COVID and their struggles and wanting to maybe change careers. And so we have to be very careful that what we do from here on out, the brunt of the problem ends up at the hospital. And when it ends up at the hospital, then you have healthcare issues, and then that begins to back up, and that's where we have some of the more serious situations. In conclusion, we have to be extremely vigilant. We know what's coming up. We know the holiday season is right upon us. We know that Black Friday is coming up. We know Thanksgiving. And there's two issues. One, obviously getting together and not being protected either by your mask or being vaccinated, but also travel. Travel was one, as you recall, first we had community spread, and that was maintained a little bit. But when we had travel spread of people going elsewhere, coming back with maybe different variations of the virus, or we don't understand that phenomenon, but we know that travel was one of the most significant things that increased our cases. We're going to do everything possible. The mayor and I, one of the things we're doing is reach out. We also learned that a lot of people from the rural communities were not able to get their vaccination. So working very hard, the mayor and I, that we reach everyone that needs to be vaccinated. We reach everyone that needs a booster, and we know we have to go out there. This is a little different. That's what I'm going to tell you right now because it doesn't seem to apply, but we're having a day of hope at Escarate that we had last year. And the reason this is significant is because our ability to congratulate, to acknowledge that our first responders, that our healthcare workers are very important in our community, we need to let them know. So I hope that you stay tuned to that. And one thing now forever, we really have to figure a way that this does not become a pivotal point. The thing that we learned the most, and I know the mayor and I have discussed that, we were not as successful in fighting the virus until the community made a determination. It wasn't mandates, it wasn't anything, but the community rallying and deciding that we were going to protect ourselves from another virus, from another spread. We ask you and we plead to you that please, help us as a community. I've said over and over, 2,800 in our rearview mirror. Let's not make a U-turn. Thank you.
Again, thank you all for being here, and this is really a proactive approach. And I think you saw a year ago, it was a reactive approach where it really got out of control and it was hard to stop. But we know that today, where we're at, and we can stop it, again, as the county judge said, by having the community rally behind and make sure that we all do the right things. We're open to some questions. Anybody have a question?
How many of the cases are breakthrough cases recently?
Pardon me?
How many are breakthrough cases recently?
Well, we have about 4,500 breakthrough cases, and which is, right now it's a very low amount, and so it's really important that we do get vaccinated. And I think the number of lives lost with breakthrough cases, again, is very minimal because you've been vaccinated. It's 35 cases. So based on your question, it's really important to make sure you get vaccinated. So, when we're talking about that we've had basically almost 800 cases in 2 days, but we've only had about 4,500 breakthrough cases, the people that are fully vaccinated, there's a big difference there. Mr. Jackson?
Yes. I have two questions. First one for...
You want to come up here, Judge?
Yes, sir.
Will the county be suggesting to any of the school districts here to have a mask mandate?
Well, the mayor and I can only recommend when it comes to the school districts. I think we have a great relationship. They have done a lot of things they do is voluntarily because I know Dr. Carranza, Chief D'Agostino, and Chief Rodriguez are always working with the school districts. But just to be clear, we can recommend they make that determination themselves.
So those recommendations will be made to the school districts?
I think Dr. Carranza is always added in anything that he says, just saying, we recommend these items, and they've been extremely well received.
My second question is the upward trend seen because of schools, or is it because of adults becoming more relaxed with guidelines against the restaurants and bars?
The answer is yes.
Yeah, both of us believe that, we drop our guard, people not getting vaccinated, people being able to get the booster and saying, well, nothing happened and maybe it'll carry forward. We have to listen to the science. We've got to stop listening to the politics, and the science tells us that the boosters are very important.
And again, know your surroundings, and that's important. And, you talked about the schools. As you noticed, Cantillo School District has closed 2 schools. Coronado High School canceled their basketball game due to the pandemic. So that's really important, and the school districts are great partners to the county and the city, and we'll continue to work with them as we move forward. Now, everything we talk about today, and that's why it's important, and we talked about what happened in March, these are recommendations, and these are things that we want our community to rally behind and understand that if we don't do the proper things, we could be infected. Yes, ma'am, how are you?
Good, how are you?
Fine, thank you.
I'm gonna drink my cola. No, I'm kidding. My question is if you can give a comment either way on the anticipated ruling from the Eighth Court of Appeals today on the mask mandate?
You know, we don't know how it's going to go, but I can tell you, based that Dr. Esperanza did issue the mandate because it was a medical, he's our medical doctor. That was the longest standing mandate that has been anywhere because of Dr. Esperanza and the job him, the city, and the county were able to do. So we just look forward to seeing. So you said either way, the answer is yes. We're looking forward to seeing what the ruling will be. Yes, ma'am. No hay problema, déjeme preguntar a mi amigo el juez. Pásale. Y yo también le puedo explicar en español, pero él me dijo, por favor, si me van a preguntar algo en español, déjame decirlo y aquí lo voy a dejar.
No, él tiene la misma habilidad que yo tengo, pero es caballero. Pero simplemente sabemos que los casos han incrementado, tenemos obviamente mucha precaución de que no vayan a incrementar mucho. Es una gran oportunidad ahorita de frenar la situación. La historia nos ha dicho muchas cosas y no aprendemos muchas veces y nos metemos en problemas, pero sabemos que lo básico de la distancia social, a utilizar la higiene, de las mascarillas, pero más que nada la vacuna, ¿verdad? La vacuna ha sido lo más importante que hemos podido hacer, pero ahorita las personas ya, muchos no se están vacunando, tienen una posibilidad de agarrar el booster y no lo están haciendo. Entonces es muy común cuando se ve una situación positiva que comencemos a relajar y tenemos mucho miedo que este es el momento que vamos a tomar a una situación muy difícil o nos vamos a mejorar. Como comunidad siempre hemos visto que es la solución. Cuando la comunidad decide por sí mismos de frenar, de ponerse la mascarilla, de protegerse, de que cada familia, y es algo que no mencioné, pero si cada familia tiene un líder que trata todas estas situaciones, alguien que de respeto, y si cada líder de cada organización toma la responsabilidad por sus empresas, vamos a tener mucho éxito. Pero este sí es un momento clave antes de los días festivos y no queremos el problema. Tampoco no queremos que no van a querer abrir los puentes totalmente sin vacunarse en enero, y esta es una oportunidad de mostrar que somos capaces de reducir los casos.
Es una cosa, le quería decir, lo que estamos hablando, que nos ha pasado en los últimos 2 días, que casi 800 personas están afectados y estamos subiendo cada día, y las personas en el hospital y las vidas que estamos perdiendo, y estamos hablando el juez y yo que una vida perdida más es una vida más que queremos ver. Y es una cosa muy importante que saber lo que estamos haciendo ahora, que usar la mascarilla, lavar las manos y la distancia que tenemos que tomar y saber dónde estamos, porque ahorita vamos a comenzar el tiempo de Thanksgiving, vamos a estar en el Christmas, el nuevo año, y es muy importante que saber con quién estamos y dónde estamos para no estar infectado y estar seguro que toda nuestra familia es la familia de nosotros, pero también las personas que trabajamos juntos, que todos estamos bien en este tiempo y en el tiempo siguiendo.
Se merece a las vacunas, hay personas de Estados Unidos que están vacunando, ¿se tiene la capacidad para atender?
No, la cosa, cuando ya abrimos el puente el lunes, y a las personas que ya tienen la vacuna, tienen que tener prueba que tienen la vacuna, y es una cosa que vamos a continuar. Another question? We'll take one more question.
Yes, to follow up on Jaime's question, speaking of crowds, speaking of social distancing, any concerns about the reopening of the borders and more people being downtown?
You know, and that's why we asked to make sure that as the federal government put out their guidelines, and the guidelines were that if you're going to come across, you have to be vaccinated. And that's what we tell you. We want you to know your surroundings, know what's going on. One of the things that was very surprising to us, as you saw, and we were looking at the cameras, the bridges were not overcrowded. The bridges, you know, it was still an even flow, and that was really important because I think people do understand, and people want to make sure, because we're one community, Juarez and El Paso, make sure that we're all safe. So I think we looked at the crossings on Monday as the bridges opened, and it was very well controlled and very well done. And with that, I want to thank you all for being here and the opportunity to please, reach our community, and you guys are very important to us, and we thank you for being here.